Next, I'm pleased to introduce Lesley Steinman, our doctoral awardee. 20 years ago, Lesley Steinman and her colleagues at the UW School of Public Health's Health Promotion Research Center were given a task to turn a wildly successful new intervention that was proven to help older adults with depression into a wide-reaching program. The intervention was called the Program to Encourage Active, Rewarding Lives, also known as PEARLS for short. It was housed in the CDC-funded Health Promotion Research Center, or HPRC, where Lesley had joined as a research assistant to fund her master's in public health and social work at UW. At the time, Lesley wasn't an expert in aging or mental health, but 20 years later at HBRC, she has helped the team and its partners research and spread PEARL's mental health impact to over 12,000 aging adults across the country. Lesley was inspired to obtain her doctorate in service of the many people in her community doing this important work who couldn't get one. She says the idea was, how do I do a dissertation that creates evidence that will help these organizations and the people we serve to gain recognition, get policymakers to pay attention, and improve supports and funding for this work? Peggy Gannon, professor and director of HBRC, who has worked alongside Lesley for 20 years, says, across all her public health research and practice, Lesley is committed to evidence-based practice, finding paths towards sustainability and serving those most underserved by our current systems. She is deeply engaged in reshaping public health to become anti-racist and anti-oppressive, and applies this engagement to her research. Having earned her doctorate in March, Lesley will use her degree to help scale up an expansion of PEARLS in California. In response to community feedback highlighting the lack of support for aging adults, the California Mental Health Services Oversight and Accountability Commission has allocated $16 million in funding. The Commission has chosen to invest in the PEARLS program, awarding grants to 8 organizations that will adopt PEARLS over the next 3 years. She's looking forward to partnering with community organizations and faculty, staff, and students across SPH to scale up other mental health and social connectedness programs. For her academic excellence and commitment to public health, please join me in welcoming Lesley Steinman.
Wow, what a beautiful speech, graduates. I promised myself I wouldn't cry, but I'm full of such admiration and exhaustion at the end of this journey, so watch out. First, we would not all be here today without the love and support of those here around us, in the stands, and in spirit, so I want to start with a moment to applaud you all. It's such an honor and a privilege to be standing before you today. It's also a little daunting. What do you say to such an inspiring group of people who've worked their buns off for months, for years to be here? Especially when you use up most of your words writing thesis and capstone reports and dissertations. So what stood out as you? The graduates that we're celebrating today, the people that make this happen. So this is my love letter to you all. First off, last night, my amazing 10-year-old daughter, Elizabeth, performed as the Cowardly Lion in The Wizard of Oz. And a year ago, she didn't think she could get up and do something like that, and that they're slaying it. And for those of you who have not seen The Wizard of Oz, you might be a little older and not remember it as a child. The story goes something like this. The young girl Dorothy is trying to get home to Kansas. Along the way, she meets a scarecrow. He's trying to find a brain, a lion who's looking for courage, and a tin man in search of a heart. They seek out a wizard to help them find things just as we sought out an education, thinking this will give us all the answers we need. And throughout the story, Dorothy, the Scarecrow, and the Lion, and the Tin Man band together and bond, just like we all did through the stress of pandemic grad school. And at the end, they realized that all along, they had home love, bravery, and wisdom inside them. This is not unlike our UW journey. We've learned so many new theories, statistics, citations, models, and yet it's us that are going to make things happen in the service of what matters, to quote Indigenous scholar Robin Wall Kimmerer. This is literature education at its finest, that builds on the original OGs, Bell Hooks, and Paulo Freire's teachings. Our education drawing out the wisdom from within embracing shared learning and knowledge, service and struggle, and love and spirit for social change. I look around at one of the most diverse graduating classes the school has ever seen. We are parents, children, grandchildren, dancers, first-generation college students. And the Talmud reminds us that we see things not as they are, but as we are. And so this representation and this lived experience is essential if we are to truly achieve what the School of Public Health mission is, to solve our greatest public health challenges and co-create health equity with communities in this region and around the world. So how do we do this? By centering our communities and those who've been systematically excluded from research and practice. I'm inspired by how all of you have brought in public health meetings. I look around my own Ph.D. cohort. Our research has created new models for understanding how living with a marginalized gender or sexual identity impacts smoking cessation, how intersections of racism and classism and sexism influence how primary care is provided, redefining resilience as public health response to stress, and how we partner with community health workers and community-based organizations to support people living with depression and other chronic health conditions where they live, work, pray, play, and age. It's this expansive research with, for, and in communities that is essential to creating new programs and policies that reduce rather than widen health inequities in support of health as a human right. And as much as we learn, it's important to remember how much we don't know. The importance of listening, of looking around, of inviting those who are not at the table, of being a bridge and sharing power. Just as these degrees instill some confidence, they should also run with humility. I'm inspired by community scholars like Dr. Ruha Benjamin, who urges us in viral justice to use these tools to grow the world we want, without having it all figured out in the first place. This is how real change happens. Small group of people can indeed change this world. And we need to come together. During our time studying at UW, it's been a difficult time for public health. Limiting of abortion and gender-affirming care, the continued disenfranchisement of Black, Indigenous, and other communities of color, increases in gun violence and hate crimes, the rise of mental health and disconnection, and the suffering of our planet. These challenges are also within. As I stand before you as an honored public health graduate, I'm also a proud School of Public Health research scientist. Last Wednesday, the research scientists and postdocs here at the University of Washington went on a strike after failing to reach a fair contract agreement for fair wages, child care support, and an inclusive workforce. These are the very few jobs that most of us aspire for and training to get. And this is what we're celebrating today, our accomplishments. Sadly, the situation is not unique. All this is happening at universities around the country, so that the people running projects and doing impactful, game-changing research can be translated into action, and those people can thrive doing it. I'm hopeful we're going to come together this week after the celebrations and reach a collective agreement to support researchers, and that UW will continue to lead the path as it is wont to do, as our school here has led changes for more equitable, just, and anti-racist culture and climate. What a better way to honor today's public health graduates. In closing, I'm absolutely thrilled to go forth in this new chapter together. We have more power than we can ever imagine. We are full of possibility. It's not just the letters that reflect the hours of training that we now proudly print beside our names. It's because of what brought you here in the first place and what will carry us on to what's next. So I raise a glass to you and congratulations, class of 2020.